As we inch towards Friday, our first day out of lockdown, the state is closing in on a key vaccination milestone. Almost 90% of eligible Victorians have now had at least one vaccine dose, and 68% are fully vaccinated. There's been a slight dip in case numbers today, with around 1,700 new infections recorded, and sadly there have been 11 more deaths, taking the toll from this outbreak to 163. Even so, we're on the cusp of greater freedoms, but it seems the devil is in the detail of our roadmap out of lockdown, and there have been changes announced to border restrictions. For more on that, Margaret Paul joins us now. So Margaret, what's changed?
So Tam, from midnight tonight, all of New South Wales has been downgraded, so there will be no more red zones in New South Wales. That means if you're coming to Victoria from New South Wales, as long as you're fully vaccinated, all you need to do is apply for that permit. When you get to Victoria, there is no requirement to test or to isolate. If you're not fully vaccinated, you'll need to apply for that permit. When you get to Victoria, you'll need to get a test within the first 72 hours and isolate and wait for the result. Now, we're not expecting that change to lead to a big influx of people coming from New South Wales to Victoria over the next few days. There's only 2 flights booked from Sydney to Melbourne for tomorrow. But it's a sign of things to come as Victoria relaxes its rules towards the end of the week.
But there have been a few teething problems, Margaret, as we gear up for Friday.
Yeah, the entertainment industry, Tam, which has done so much work over the past 18 months, they're a bit upset tonight because they were initially told in that roadmap released on Sunday that they would be following the same rules as hospitality, which would mean they could have 20 fully vaccinated people inside. Now, that doesn't mean much if you run a large venue like the one behind me, but for smaller venues like comedy clubs and cinemas, they had already gone about booking those gigs for this weekend. Just a few hours later, though, the document was updated on the Premier's website and the word entertainment was just left off. Now, the Premier's office has clarified and said that it was the wrong words in the wrong place in that document. It wasn't a change of things, but for those venues who'd already gone about booking gigs, they say it's pretty gutting. We spoke to one comedy club today in the city who'd already gone about booking gigs across the weekend. They'd sold more than 160 tickets across various gigs for Friday, Saturday, Sunday. They'd booked comedians, they'd changed their plans, and now they're having to go about the process of giving refunds again. Let's hear from the comedy club owner.
They gave us this little crumb and then they were like, oh, no crumb for you. It was like they'd cracked open the door just enough for us to get our hand out and then slammed it shut.
I think within hours of a typo being up on a website somewhere, that was corrected. And again, I apologise if there's any sense of that a sector's been included that shouldn't have been.
So the Premier's clarified that those industries, the entertainment industry, will be able to open under the roadmap when Victoria reaches the 80% fully vaccinated milestone, which is due about 8 or 9 days after this Friday's milestone.
Long after restrictions ease on Thursday night, the havoc wrought by this Delta outbreak is set to linger, and nowhere more so than in our hospitals. The strain on the health system is now so great that all but the most urgent of procedures have been cancelled indefinitely. Eden Hennanen reports.
In southwest Victoria, Ararat resident Teresa Morgan has been waiting about a year to get surgery on her prolapsed bowel.
I can't actually go out and socialise and that because I need to stay close to the toilet. Eating is actually causing me discomfort as well, and going to the toilet is a big hassle.
Lucky.
It's considered a Category 2 type surgery, but she's been told she must continue to wait because of the pressures on the healthcare system from COVID.
But it's been 18 months now, so they're opening up a lot of the states, so they should be able to do it.
In Melbourne, doctors recommended Linda Rudman get a mastectomy 2 years ago to protect her from an elevated cancer risk.
It's a very anxious wait.
The Category 3 procedure was supposed to be done within a year, but she's still waiting.
You never know when it's going to come and grow, if it does, and you worry. You have scans and you have scanxiety.
All health services in most parts of the state have limited elective surgery to Category 1 and 2A procedures, which are considered to be the most urgent. But even those in Category 1 that can include major cancer surgeries and aneurysm procedures are having their surgery delayed up to 30 days.
The distress, I think, is not just felt on the part of the patients who are missing out on elective surgery. You know, as the doctors who treat them, it is distressing for us as well.
The sickest have got to be treated quickest, but we'll get to catch up. We'll get to deal with that backlog just as fast as we possibly can.
The sickest Victorians with COVID-19 continue to fill beds in intensive care units. 96% of them are not fully vaccinated. To help with these rising pressures in hospitals, the state government is setting up 20 new suburban respiratory clinics. And in a final push to reach vaccination targets, the government's pledged more money to provide easier access to the vaccines, helping places like this restaurant play their part in the rollout.
I don't play politics with states, but it does not compare to the sausage sizzle. If you are Melbourne, you are the chickpea bake. You certainly know what that is.
An appetising push to get the last of Victorians vaccinated. Eden Hennanen, ABC News, Melbourne.